There was a time when one of my friends came to me and she was very, very stressed. She said, my period is late. It wasn't just her body feeling tense, but her mind was as well. Because when your period is late, your thoughts don't stay still. They start to spiral. And in that moment, it's not just about your cycle anymore. It becomes, what is happening to my body? So I checked the pulse, asked her a few questions, and told her gently, your body is under a lot of stress. It hasn't forgotten what to do. It is choosing what to prioritize. I gave her a really simple acupuncture treatment. Nothing aggressive, just helping her system settle. And guess what? Someone came the next day. Aunt Flo. Not because we forced it, but because we supported what her body was already trying to do. Now that was a delay, but what many people don't realize is this. Sometimes it starts like this, a delay, and sometimes it goes further. A late period can become an irregular cycle. An irregular cycle can become an absent one. And when your body stops menstruating for several months, that is when we enter what modern medicine calls amenorrhea. And this is where many people start to feel lost. Healing's like 10-year garden, and in every video we water the roots. Hi everyone, I'm Dr. Amy, a traditional Chinese medicine doctor guiding you to understand your body, restoring balance, and to heal naturally. Now, this is where understanding is very important. In traditional Chinese medicine, we don't rush to label something as wrong. We look at what has shifted. Because your body is always responding to how you live. Your cycle is not random. It is responsive. In modern medicine, this is called amenorrhea. In TCM, we understand it as a change in movement and availability of blood. For menstruation to occur naturally, the body needs qi to move, blood to nourish, smooth flow from the liver, and warmth from the yang. When these are not in balance, the cycle may pause. So when someone comes to me with missing periods, I always start with asking, what has changed? Because I need to understand what your body is adapting to. Is it the stress, workload? Did someone pass? Did you break up with someone? Because in TCM, the body is always responding. One of the most common factors is stress. In Chinese medicine, the liver governs the smooth flow of qi, emotional regulation, and menstrual rhythm. When stress becomes ongoing, qi becomes constrained. And when qi doesn't move, blood doesn't move. Over time, the body may pause menstruation in order to regain internal balance. The second thing I look at is nourishment. You are what you eat. Menstruation requires blood, and blood comes from the food you eat and how well you digest it. If the body is undernourished, over-exercised, or not absorbing nutrients well, blood may become insufficient. And when there isn't enough blood to release, the cycle may become lighter or pause altogether. Next, what is equally important is body constitution. Because some people may naturally tend towards certain tendencies. And these patterns influences how your body reacts to stress, weight changes, overwork, and dietary imbalance. For example, if you tend towards yang deficiency, your system may already run cooler and slower. And this is why health is never a one-size-fits-all. The next thing that is so important to understand is that menstruation at its core is a movement process. And movement requires warmth. If yang is lower, circulation would be slower. transformation, your digestion and absorption will be less active, so your metabolism decreases, and therefore your body turns inward. It starts withdrawing. And then over time, the cycle may not initiate as regularly. In Chinese medicine, we understand this very simply. When the body does not feel safe, it does not prioritize reproduction. It prioritizes survival. And menstruation is not essential for survival. Now, let's go one layer deeper. Because in clinic, amenorrhea isn't just one simple cause. In TCM, we look at patterns. And it mostly comes down to three main areas. Not enough nourishment, not enough movement, or something blocking the system. Not enough nourishment would be qi and blood deficiency. So there wasn't enough of anything, your energy and nutrients, to flow. So sometimes it's not that the body is blocking the cycle. It's that there isn't enough to release. The uterine lining wasn't bolted up because there was nothing to bolt with. And this can happen with long-term stress, irregular eating, over-exercising, or chronic fatigue. When your qi is low, movement is slow. And when your blood is low, there isn't enough to start your cycle. So your body does something very intelligent. It pauses menstruation to conserve resources. So with qi and blood deficiency, you may notice symptoms such as dizziness, pale complexion, and poor concentration. Next is not enough movement, which is usually liver qi stagnation. So, other times, there is enough energy and nutrients, but it is not moving. This is very common in high stress, emotional suppression, or overthinking. The liver is responsible for flow. And when that flow is constricted, qi becomes stuck. And remember, blood follows qi. Therefore, if blood cannot move, the cycle cannot continue. And common signs of liver qi stagnation is irritability, breast tenderness, bloating, or that stuck feeling in the body. Alright, so this part is less talked about, but very important. And very common as well. Phlegm and dampness. So if the body accumulates enough phlegm or dampness, it can physically block the pathways of qi and blood. This is often seen with weight changes, sluggish digestion, or if you have a thick tongue coating. In modern terms, this overlaps with metabolic issues, hormone imbalance, and conditions like PCOS, which we will cover in another video. I know I said it mostly comes down to three main areas, but there's a fourth area that I forgot to mention, which is the cold in uterus. So sometimes it's simply because of the lack of warmth that is delaying your cycle. Remember, cold slows everything down. So when the system is cold, the circulation slows down. Transformation of nutrients slows down as well. And therefore movement becomes difficult. And like I mentioned previously, menstruation requires movement. So what does treatment look like in TCM? Well, it depends on the pattern. If there is deficiency, we nourish. If there is stagnation, we move. Where there is cold, we warm. And where there is phlegm and dampness, we transform it. And now, this is why one diet, one herb doesn't fit everyone. So, what are some practical things that you can do at home? A warm footsake. It is excellent for improving your circulation. Not only that, it relaxes your body and stimulates qi flow. So, use comfortable warm water and soak your feet in there for 15 to 20 minutes. And then during the foot soak, you can stimulate these three acupressure points. The first one is Saninjiao. It is for finger width above the inner ankle of the highest point. This point regulates menstruation, nourishes blood, and relieves cramping. Taitong is a very familiar acupressure point if you have watched many of my videos. It helps with releasing stuck qi. So it is at the top of your foot between the big toe and the second toe. So you take your finger, you glide it upwards on the web of the feet And then right before you hit where the two bones meet, that would be where Tai Chong is. And then the last one, Tai Chi, it is in your inner ankle. And then between this point of your inner ankle and the Achilles tendon, that is where your Tai Chi is. This point supports your kidney yin and yang, warmth, and your foundational energy. Massage each point gently for 1 to 2 minutes. Remember, consistency matters more than intensity. You may feel a slight ache or spreading warmth. That is good. This indicates that the chi is responding. You don't have to push these points only during a foot soak. You can push them anytime. But one thing I want to advise for a foot soak, if you have high blood pressure, please keep it below 10 minutes. And please also make sure that the water is not boiling hot. It needs to be a comfortable temperature. So my darlings, even without foot soak, there are other simple ways to support your system. Eat warm, cooked, balanced meals. Avoid excessive cold and raw food, like your salads, smoothies, iced coffee. Move your body gently, such as going for a jog, Tai Chi, yoga. Even light resistance training is fine as well. Practice your emotional release, so things like meditation, journaling, creative expressions, playing music, dancing. These all help. And last and most importantly, sleep early, before 11 p.m. But honestly, I think before 10:30. Remember, you are not forcing your body. You are creating the right conditions for it to function naturally again. Now, it is very important to monitor your cycles. Even if some women occasionally skip a cycle or have a period every 2 to 3 months, I know I do have patients like that. I've seen actually 2 patients like that. They have a cycle every 3 months. In a way, that is very, very convenient. But back to the topic. The most important factor, regularity, flow, and number of days of menstruation. Secondary discomforts like fatigue, bloating, cramps, please watch my video on that after this video, or mood changes should be observed. So if your cycle disappears for 3 months plus, that is a signal for you to check in properly. I always recommend my patients to come in with a hormone panel, thyroid function, and basic imaging. TCM explains patterns. Modern medicine checks structure. Together, they give a complete picture. So, my darlings, do not panic. Your body is not working against you. It is adjusting and it's prioritizing survival. Your body is very intelligent and it's adapting to its current conditions. Your cycle is not something that you lose. It is something that your body regulates. Regulation depends on many things: nourishment, movement, and warmth. When these are supported, the body often finds its rhythm again. Healing is like tending a garden. Sometimes before something blooms again, the soil needs care first. So my darlings, if you're sitting here and worried sick about your missing cycles, do yourself a favor. Sleep early, eat warm, and first forgive yourself because you are going through so much and your body is only trying to keep up with the stress or whatever it is that is worrying you. Take a deep breath, and with what you've learned from this video, try some of the advice I recommend. And please don't be scared to go visit your local TCM doctor to help you look at your body constitution and to help you naturally find your flow again. Thank you so much for your time, and thank you so much for the comments and messages. It means so much to me. I understand that menstruation, it really isn't easy, which is why I created a playlist on feminine health. The more information we have, the better equipped we will be. Comment down below on the next feminine health topic that you would like me to cover next. So my darlings, I wish you all good health, and good health is the ultimate fortune, the only investment with endless return. And when do we start investing? Right now.